Hi class, I'm Sydney Mazer,
And I'm Emily Cox.
and today we're going to teach you how to use a handy oral hygiene aid you've probably never thought of, knitting yarn.
Who will use this aid? The indications for the use of knitting yarn are as follows. Patients with implant abutments, under sanitary partials, diastemas or isolated teeth, type 2 embrasures, gingival papilla partially fills space between teeth, or type 3 embrasures, gingival papilla is or almost completely absent from space between teeth due to disease. Distal most posterior tooth.
What areas of the mouth does this aid address? This aid addresses the extra large spaces between the teeth that are usually associated with gingival recession. Regular floss is too thin. To adequately floss the interproximal area between adjacent teeth with larger embrasures or spaces, the client needs a thicker floss, thus making the knitting floss ideal. With its increased width and textured surface, the knitting floss will do a more proficient job of removing plaque and food debris from the larger spaces.
Contraindications. Type 1 embrasure, gingival papilla completely fills space between the teeth. Disadvantages. May catch on appliances, become stuck on appliance, and damage upon removal.
Advantages. The advantage of using the knitting yarn is that the thicker strand removes the increased amount of plaque and food debris that accumulate in larger spaces of type 2 or type 3 embrasures, diastemas, isolated teeth, abutments, or partials. The textured surface of the yarn does a better job of catching, trapping, and removing food and/or bacteria particles in the mouth. Have a good day!
Okay, we're going to do a demonstration on how to use knitting yarn. First, you're going to take a piece about 18 inches long, wind around your middle fingers, and hold taut between the thumb and the index. And then you're going to place into the interproximal space of the teeth, up and down in a seesaw motion, forming a C shape around the tooth. And there you go.